I'm doing good. How are you?
I'm doing well, thank you. Are you ready to jump right into our interview today?
Yes.
Okay. Well, so the first question we have, I just want to know a little bit more about your background and experiences.
Okay. Well, I graduated with a bachelor's in middle grades education from the College of Coastal Georgia in 2011. In that program, I completed a one-year internship. Most schools only do a semester, but our director required us to be in a one-year internship. So we had the first semester of the internship, we had 3 days a week in the school system in the same class. So we started at the beginning with the class, so they became familiar with us. And then the second semester, we actually took over 5 days a week.
Oh, okay.
And I was in a 5th grade class. So it was all subject areas. Well, I graduated, and then I decided I wanted to go back to school and do speech therapy. It just seemed like a better fit for me because I liked the medical aspect of it as well as the teaching. So it was a happy medium for me. So I went back and got my second bachelor's in communication sciences and disorders. And then I applied to the Armstrong program for the master's program for speech. Got into Armstrong. Thank goodness it was the only program that I applied for because I really wanted to get in. So I traveled back and forth between Brunswick and Savannah. And I felt like I just wanted to get in. So I tried to work really hard to get in, and I did. So it worked out good. I also taught horseback riding lessons for about 10 years, and I was a summer camp counselor for that program every summer for the 10 years that I was there. So I had a lot of experience with working with kids and working with even adults, teaching and doing that kind of thing. So
Okay, great. So let's talk more specifically about this position. Why did you choose to apply for this opening?
Well, I've always been interested in working for the healthcare industry and specifically working with acute care patients. I understand that this is a very challenging position mentally and physically, and I feel like I would be a really good fit for several different reasons. My graduate program and background in the medical field, I worked for a doctor's office, a cancer doctor, a hematologist and oncologist for about 5.5 years throughout my college experience. So I feel like working with both those inpatients and outpatients, specifically performing the dysphagia evaluations and treatments, has prepared me for this. I completed an online course training that you might be familiar with called the Modified Barium Swallow Impairment Profile. It's an online computer course that I understand can take people several months to complete. And I just became really interested in that. And then my supervisor at the hospital this past semester, she worked mostly with dysphagia patients. So I was really interested when this position became available because it's where I've always pictured myself being.
Okay, great. So we touched a little bit on it earlier, but what specific qualifications do you have for this position?
Well, I know that from firsthand, working in an acute care and rehab setting is difficult and not for the faint of heart. I feel that the experiences that I've had during my internships has really helped me grow as a clinician, along with my educational experiences. So the course on dysphagia was about 7 weeks in length. Part of the load outside of regular academics involved completing the online program. And so according to professors, it normally takes months for professional clinicians to complete on their own time, and we're required to pass the end of course testing with about 80% or higher in just 7 weeks. So I was really motivated to pass, obviously, but it was an extensive course that helped me evaluate the integrity of a significant amount of swallow studies on about 17 different levels. So you were only allowed to pass to the next section once you had completed the previous section. I feel like that really taught me to be more aware and detail-oriented when it comes to swallow studies. And I feel like this training has made me a better clinician in these ways, and to know and understand that each patient is different. So to assess them more individually and not just have a rote script in your head of this is how a swallow study should be, because they're all going to be different. So I think mostly with that and working with so many different patients has really helped me, and I think I'll be a good fit for this position because of that experience.
Okay. So now we have the obligatory strengths and weaknesses question. So let's start with some strengths, and then we'll go ahead into some areas that you think you might have for growth.
Well, I never liked this question because it's hard to step back and look at yourself and evaluate yourself that way. We had to do this several times throughout my program. So I think I've narrowed it down to 4. First one, I would say I'm definitely a multitasker. I've worked several jobs throughout college at the same time, taking care of horses. I graduated one job and went to another, or graduated with one program and jumped into another program. I date someone who has a child, and I went to school an hour away, so I was able to balance all of these things and still come home and have a normal life and take care of my duties and be successful in all areas.
Mm-hmm.
I also feel like I am organized. So one semester I was in about 7 different groups with various students, between clinic and 2-stroke groups and different class activities and presentations that needed to be handled. I think that they did this on purpose to prepare us for the real world, and it was successful for me because it was really challenging as far as challenging my organizational skills in a way that had never been challenged before. So I think I learned a lot this semester from that. I also feel like I'm a leader. Sometimes people don't want to take control of a situation because they don't want to seem like they're micromanaging or stepping over someone. I don't feel like I have a problem taking the lead of an issue or a task if it appears that it needs to be done. I also don't have a problem stepping down if someone's ideas seem to be more of a better fit or more appropriate for a successful solution. So I know that there's a lot more to learn, and that this position would be a great learning experience for me to help further my growth as a clinician. And I also feel like I'm a people person. I've always worked in customer service-based industries. I have a lot of friends in different types of groups. I feel like I'm pretty versatile and able to adapt to whatever group or field that I'm in to become a successful team member.
Okay. And then let's talk maybe about some weaknesses or some challenges that you might have.
Well, I feel like I'm becoming more knowledgeable with the medical setting. I think one thing that I would like to learn more of, or maybe I definitely feel like I've already become more successful in this area, is understanding how other jobs within my facility or environment relate to me as a speech therapist, as far as like nursing roles or doctor roles, so that I can take that information and plug it into what I'm doing to better understand what's happening with a patient, and so that I can go to that patient or that patient's family and relay a message in the proper format and to the best of my ability, with still staying in my scope of practice.
Okay.
When I first started as a clinician, I had a really hard time seeing the bigger picture. So, for example, when I first started seeing patients, it was difficult for me because I wanted to see more progress for them every session than some of them were capable of. I had a student, a child, she was about 8 years old. She was my first client, and I had this wonderful lesson plan or wonderful therapy plan made up for her. And when I walked in, I realized that she was not going to be able to do anything that I had planned for. So right off the bat, I had to be flexible with her because everything that I tried just wasn't working. And so it made me feel like I wasn't a good clinician at the start. Like, what have I got myself into? Because I wasn't able to see any difference. But I had her for one session. I had her for about 9 months. And at the end of the 9 months, I really felt accomplished because her mother actually came up to me and told me that she was going around the house and singing her ABCs, and she was tying her shoes, and she was saying her colors and being able to match letters and do things that she wasn't able to do at the beginning. And so it was really then that I realized, okay, it's not about the day-to-day, it's about the steps that takes you to get there. So
Great. Okay. So you've kind of touched on a few of them, but maybe talk some more about some unique clinical experiences that you've had, and maybe some ways that you've made a difference in a patient's life.
With that same client, I kind of talked about her mom. Just, it made me feel good to know that I was making a difference in her life. I was also above the stroke group, in charge of the stroke group at the Armstrong Clinic, and they seemed like they were a bit burnt out on worksheets and creating life or timelines of their life. And so it was challenging for me because I had to bring in different activities for them to do. So one thing I had them do was each bring in their iPads or computers, and some of them didn't have any, so I had to provide that for them, which we had plenty of computers at the clinic, or they could have used mine. But a couple of therapy sessions, I had them plan for a family vacation where they use the technology to come up with where they were going, how they would get there, and different various activities. One guy who used to be a photographer who had a stroke, he came up with planning a cruise because he really used to like going on cruises. And they all seemed to really love it. Even the lower functioning adults who had difficulty speaking, they were proud to talk about it in front of the group, and it made them more comfortable with one another. Then apparently none of the other clinicians allowed and it could have been for HIPAA reasons, but I talked to my supervisor about it and she seemed okay with it. But I had a new person come to the stroke group, and he was very, very, very uncomfortable because he had had his stroke maybe 4 or 5 months prior to coming to the Right Care Center. And so I spoke with my supervisor about allowing him to bring his wife in, and she was fine with it. And so he brought his wife in, and then he seemed more comfortable with participating. And then other people started bringing their spouses in, and it just grew, and they were just really happy, and just, I don't know, I thought it was an interesting experience for them. That's...
Okay. So again, along the same vein of questions, what's been maybe your most challenging case that you've had?
As far as challenging cases that relate to swallow studies or acute care, recently I worked with a trach patient at the hospital who needed a Passimira speaking valve. She was interesting to me because she was paraplegic. She'd been in a motor vehicle accident several years ago, which left her limbs very hyperflexed. It was difficult to understand her with the Passimira valve, and she was very medically fragile. So it made me a little uncomfortable at first because I had only had experience with the Passimira valve because we had a representative come from the company the semester before to actually discuss like the role of Passimira and placements and the different speaking valves and things like that. And so although I was a little bit nervous about working with her at first, I think having that background helped me because she was so challenging. So I understood more of the lingo of what was going on, and it was just easier for me to get through it and to help her become successful at speaking, and she was. So it was great. And then kind of the same thing with the stroke group, how it was very challenging, and it was interesting and fun coming up with different activities from week to week that would be appropriate for individuals with the different levels of cognition.
Okay. Well, we like to think we take a really team-oriented approach here at the facility. So tell me about a time when you felt like collaboration was really important and successful.
Well, I had a patient who has dementia, She was a very happy patient. She had a very short attention span. And she would tell the nurse one thing and tell me one thing and then tell her family another thing. And so it was crucial for us to all work together, and even the doctor. It was crucial for everyone to work together outside of the patient to, and still take into consideration what she said, but to provide, a more effective and a safe condition or decision plan of care for her, because she just wasn't able to do it herself. And so it was very important for all of us to get together and just say, hey, this is what I've done, or make sure our notes were very thorough and work together to make her be successful.
Okay. So another one of those standard questions, and then we can wrap it up after that. Where do you see yourself in 5 years?
Well, I think my first step is to get my C's after my CF. And at some point I would like to be in a supervisory role and expand my knowledge in this field. Professional development has always been really important to me. Part of the reason why I chose this field of study is because the medical field is ever changing, and it's interesting to me to learn about different disorders and how medical practices work with those disorders. And then I really hope to pay it forward for future SLPs by either becoming a mentor or a CF supervisor after I've been working for a few years to earn my C's, to kind of just give back to students, because I feel like I had a lot of support in my program and with friends who were SLPs, and I just don't think that everyone has had that support, and I'd like to give it back to young clinicians.
Okay, that's great. All right, well, that concludes our interview, and we can go ahead and take a tour of the facility.
Okay.
All right.
Thank you.
You're welcome.